Okay, let's talk about something that so many women experience, but almost nobody talks about: painful sex, or what doctors call dyspareunia. Now, if this is something you're dealing with, you might feel frustrated, maybe a little confused, or even just completely alone. Well, today we're going to break that silence.
For
We're going to
so
dive
many of
into
us,
the real,
intimacy can get
evidence-based
tangled
reasons for
up with
painful sex in
anxiety and
midlife,
pain.
and more importantly, talk about the clear
For
paths
so
to
many of
feeling
us,
better.
intimacy can get tangled up with anxiety
Let's just
and
look
pain.
at this number, 7.5%. According to a major UK study, that's the percentage of sexually active women who said they'd experienced painful sex in the last year. So let that sink in for a second. This is not some rare, out-of-the-blue problem. It's a really common health issue, and it means if you're going through it, you are definitely not alone. And this is so, so important to get right from the start. Let's read this quote from our source material together. This is a genuine physical symptom. It is not all in your head, and it's definitely not a reflection of you or your relationship. It is simply your body sending you a signal that something needs attention. And today, our job is to figure out what that signal means.
So you might be wondering, where are we getting all this info? Well, everything we're covering today comes directly from expert guidance published by the Women's Health Clinic, and it's all been medically reviewed by Dr. Farzana Khan. That just means we're working with credible, compassionate, and up-to-date clinical information as we walk through this together.
All right, here's our roadmap for today. We're going on a clear journey from validation to action. First, we'll talk about the unspoken pain. Then we'll get into the why does it hurt part. After that, we'll cover how to get answers, then explore the pathways to relief, and finally, we'll wrap up with your actionable next steps. Okay, let's dive right into our first section, the unspoken pain. Because, before we can find answers, we've got to have the right words to talk about the problem in the first place. So the official term is dyspareunia, but here's what's really important on this slide. The very first thing a clinician wants to figure out is where the pain is. Is it right at the entrance, what they call superficial or entry pain, or is it something you feel deeper inside? Just figuring that out, pinpointing the location, is a huge first step in the investigation. And that leads us perfectly into section 2. Why does it actually hurt? Really getting a handle on the biological reasons is absolutely key to finding a solution that actually works. For a lot of women in midlife, perimenopause, and menopause, this condition is a major player: genitourinary syndrome of menopause, or just GSM. See, as estrogen levels drop, the actual tissues of the vulva and vagina change. They get thinner, they don't have as much natural moisture, and they become a lot more fragile. So they're much more likely to get tiny tears and inflammation during sex, and that right there is the pain. This brings us to a really common myth. So many of us think, oh, I'm just dry. I just need more lubricant. And look, lubricant is great. It definitely helps reduce friction. But when you're dealing with GSM, it's kind of like putting a bandage on the problem. It doesn't fix what's going on underneath. The reality is that local estrogen, that's vaginal estrogen, treats the root cause. It doesn't just add moisture for a little while. It actually helps rebuild the tissue, making it healthier from the inside out. But hey, GSM isn't always the whole story. The pain could be coming from muscles in your pelvic floor that are way too tight, almost creating a wall. Or it could be a specific skin condition, or even tight scar tissue from having a baby. And of course, you can't rule out infections. The big takeaway here: one size does not fit all. You really need a proper diagnosis to know what you're dealing with. Which is the perfect lead-in to section 3. A lot of women put off getting help because they're worried about the appointment itself. They don't know what to expect. So let's just pull back the curtain and demystify what a really good expert assessment for painful sex is actually like. I think this is the question that stops so many people from even making the call. What really happens in that room when you finally say the words "sex hurts"? Well, let's break it down. A good assessment really just follows these 3 simple steps. First, and this is the most important part, is the conversation. A good clinician will just listen to your story to figure out what's going on. Then, and this is key, only with your full consent, there might be a gentle physical exam. And finally, you create a plan together. It's not something that's done to you, it's a partnership. And honestly, this is the most important message to take away from this section. You're always in control. In fact, if your symptoms really clearly point to GSM, a doctor can often prescribe the right treatment, like vaginal estrogen, without even needing to do an internal exam. Your story, what you tell them, is that powerful.
Okay, so we've talked about the problem, we've demystified the diagnosis, now let's get to the good stuff. Section 4 is all about real, tangible solutions. We're going to focus only on the treatments that are backed up by solid scientific evidence. This table lays out the heavy hitters really nicely. For those tissue changes we talked about with GSM, vaginal estrogen is the #1 treatment recommended by health bodies like NICE in the UK. For pain that's coming from muscle tension, pelvic floor physiotherapy is absolutely key. And to help with the fear and anxiety that can build up around pain, psychosexual therapy is a really crucial piece of the puzzle. It's often a team approach. Now, you've probably seen ads online for other treatments, maybe things like vaginal rejuvenation that use lasers or other energy devices. It's really important to be an informed patient here. This quote is from an FDA safety communication, and it's basically a warning that the evidence just isn't there yet to prove that these devices are safe and effective for treating these conditions.
And it's not just the FDA saying this. Over in the UK, the National Institute for Health and Care Excellence, NICE for short, they say the exact same thing. The evidence is limited, so these devices are not recommended as a routine first-line treatment. The focus should really be on those proven options we just talked about. And that brings us to our final section, where we put the power firmly back in your hands. This is your toolkit for self-advocacy. We're going to give you the exact words and questions you can use to make sure you get the amazing care that you deserve.
Seriously, you could just take a screenshot of this slide and bring it to your next doctor's visit. These questions are designed to kickstart a really productive conversation. They help you go from just being a patient to being an active partner in your own healthcare, making sure you cover all the important angles together. So let's end on this thought. Pain is a signal. It's your body trying to tell you that something needs attention. It is not a life sentence. It is not something you just have to put up with. It is just a message. And now that you're armed with all this information, you are ready to start that conversation and finally figure out what your body is trying to say